Hey, I hope you're doing well out there. It's Dr. Matt here. Someone had asked me earlier, or at the end of last week, in regards to upper back injuries and as well rhomboids and rib heads, right? So it could be a real challenge, especially breathe deeply. You may find your breathing's affected, and a lot of the mechanics on how you lift is going to be implicated with your, excuse me, your upper back, right? So one of the things I like to do is just focus on making sure you're breathing properly. So deep breaths in and all the way out. Can you do that fully and functionally, right? And also, grab yourself a lacrosse ball or a foam roller. And what I like to do, especially where your shoulder blade, in between your spine and your shoulder blade, you may find some of those areas are, you may have been described as the rib out, right? That's just an easy way to describe it, but there's a plethora of things going on when you're injured, or if you're just trying to help yourself function better, be proactive. So one of the things I like to do is grab this, and you just put it down on the ground. You're going to work your arm through different ranges of motion while you breathe, right? And when I find a tender area, I'll just hang out there, breathe into it. And when it gets easier, I'll move on and readjust my arm, right? But mainly what you're doing is you're taking this and you're just trying to desensitize the area and loosen it up a bit more, okay? So what I would do is put this on the ground. You may be anywhere on the ground from 30 seconds to 2 or 3 minutes on one side. So I'll set it up on the ground and I'll lay back onto it just like this. And from here, reach over my head. Yeah, that's pretty easy. I'll come down to the bottom and maybe a little bit more tender, and I'll just hang out there and breathe into it. And you can change your range of motion. You reach up, and rotate your thumb. So you turn your hand in, as well as turn your thumb out and away when you come up. And that way you really move your shoulder around and get your shoulder blade moving, your scapula. And what I would do is hang out there for, like I said, 30 seconds to 2 or 3 minutes, and just work on different areas between your spine and your shoulder blade. Breathe into it. You can do it at the beginning, see how you feel. You go and do it, and then get back up and retest and see how things are moving around and see how much tension there is. So start there. This can be a big improvement right there in terms of your own self-care. The other thing is you have your rhomboids and your traps all going through that area, which are the superficial muscles. So what I would do is just get yourself moving again, right? And you may be off, your movement patterns may be off. As soon as if you're dealing with injury, as soon as you get injured, there's more of a disconnect between your brain and the way your nervous system controls that joint. So you want to start to bring up that awareness again. And what I like, even as daily maintenance, is just grab a band, right? And what it looks like is just the band pull apart. So just from here, palms down, or if you want to switch it up, palms up. And from this position, I'd go anywhere from 12 to maybe 25 or 30 reps. Keeping your head straight, chin tucked slightly, and squeezing your shoulder blades together at the top of the range of motion. So give that a try, and like I said, 12 to possibly 30 reps, because it's going to be more of an endurance training of that muscle, right? Posturally speaking, to keep you upright and make sure everything's gliding nicely and moving well. So give that a try. Those two things can make a big difference, right? And don't forget, at the end of the day, what's controlling the whole show in terms of how you heal, how you optimize performance, is going to be your brain, right? So it's got to send, and that's exactly what we deal with in the office, right? So it's got to send messages to communicate with your body, and it does that through the extension called your spinal cord, right? Now, if you're shifted or there's any disconnect in the communication, that's going to be a factor always in how you heal and how you recover, right? So if things are holding you back, also consider that if your spine's shifted, it's going to be a factor in how you're going to recover and optimize performance, right? And not only is it going to be shifted mechanically, but it can be putting pressure on those nerves and being a disconnect between how your brain communicates with your muscles, but also your organs, okay? So anyways, think about those 3 things, and I'll talk to you guys soon. If you have any questions in the comments, please let me know, or you can reach out. My contact information is there, okay? Otherwise, have yourselves a great day, and I hope that helps. Bye for now.